Awesome. Hey everyone, welcome back to another virtual shadowing session. We have Dr. Ruby with us today. She is amazing and she's going to be sharing some great tips, her journey, and any other advice you may have. So whenever you're ready, you can go ahead and start.
Awesome. So first of all, I want to thank you guys, Fresh Dental Shadowing, for having me on tonight. Dentistry is something that I am very passionate about, and I can talk hours upon hours about it. So thank you for that opportunity, and thank you for organizing this. During these unprecedented times right now, it's very easy to get discouraged or not know what to do. So the fact that you guys are providing this resource is amazing. So hats off to you guys. All right, so let's get started here. Firstly, my name is Dr. Rubia Charania, but most of my patients call me Dr. Ruby. And the main reason for that is I like to keep an informal relationship with my patients because they want to feel comfortable, they want to feel as if they can trust you, The mouth is a very personal part of your body. So in order to make them comfortable, I try to keep things as informal as possible, and it goes a long way. So here we go. What am I going to be talking about today? Lots of stuff. So the first thing I want to go through is my experience as you guys, right? Pre-dental college students are thinking about it, not sure what to do. I was once in your shoes, and let me tell you, it was a journey. But this is something that I'll expand upon. During the journey, you learn a lot and you figure out what it is you really want. So we'll be touching upon that. The other thing is we're going to talk about how I decided to get a master's degree. And the reason for that is, again, a lot of it had to do with figuring out if I really wanted to do this. I will tell you, there are many, many professions where you can do well and have a family and do all of that. But dentistry is very unique and you have to really love what you're doing to do it. So we'll get to that in a second. And then my application process was just as arduous as yours guys is probably right now. So we'll talk about that. We'll also talk about what dental school is like. I'll give you guys like a little timeline and overview of how it started and what I did and all of that. And then we're going to talk about community service because me personally, I think that's the most fulfilling part of dentistry is the idea of being able to access the underserved in your community and just provide them with information and help them better their health, They say oral health is connected to your systemic health. So the idea is that if your oral cavity is healthy, most likely it's going to help the rest of your body. And then we're going to talk about my residency experience and what that was like and how that prepared me to be where I am now. And then we'll talk about how I decided to just be an associate versus not specialize. So we'll discuss that and what I'm doing now. And then I'll just give you guys some advice. And one motive you'll see kind of through this whole thing is that all good things take time. And it's really about being patient in your journey and really just embracing the fact that growth comes at its own time and you got to just embrace it. So let's get started here. My not so glamorous life as a pre-dental college student. I think, you guys probably can definitely relate. Learning to study and figure out how each class works and how to succeed is very, very different, right? Depending on what class it is and what the requirements are and all of that. So I went through the same thing you guys did, right? I majored in biology, I minored in psych. And like everybody else, I'm like, yeah, I want to help people. That's why I want to, be a dentist. But there's a lot that goes into it aside from that, and we'll get to that. But I started with the same courses, right, that we all take, the foundational courses. And during that time, I struggled. I basically got a D in organic chem, and that was very discouraging, right? And my advisor at the time had told me, you might want to consider doing something else because you got to stand out as an applicant. And of course, I went home, I cried, but I said, you know what? I still want to try. I still want to do this. So, as a message to you guys who may be struggling with a class or two, don't let your experience in those foundational classes reflect upon your what you sense is your ability, because there's so much more that goes into dentistry and beyond that has a lot more than just what is taught to you in foundational courses. So don't be discouraged. It won't entail your success after at all. And the last thing I want to touch upon, and I think it's really important for you guys to do, given the situation now, it might be hard, but once things hopefully settle soon, right, with the pandemic, is try and get some in-person exposure to the field. Because that's really the only way you're going to be able to know what dentistry entails. And I had that opportunity with my mom's general dentist. She was a female, very relatable, right? You want someone who's going to be relatable, but also someone approachable that you can ask questions to and kind of gauge, is this something that I think I can see myself doing? So that was for me, my beginning stages. So I graduate college, right? And my grades, they were okay. I was just average, right? So I took the DAT after I graduate, got a good score, but not amazing. And I just shot my shot and I got rejected from all 4 schools that I applied to. So I decided I had heard about this biomedical master's program and how you can get asked like different aspects of not just dentistry, but a lot of other parts of the biomedical sciences. So I said, you know what? Let me see what this is about. And in this experience, it's great because not only are you able to learn more about the different biomedical sciences, but you can also become a distinguishable applicant in the sense that you get to up your grades. You get another chance at it, right? To just have another semester or two worth of grades, and they'll be able to see something more recent that will hopefully be better, and that'll make you stand out as a better student. And it's also just going to give you more knowledge, right? And that's what it's about, just learning. So I myself went to the University of Medicine and Dentistry of New Jersey. Now it's called Rutgers Medical, but back then that's what the school's name was. And I got a great experience just learning again to just study efficiently and learn well. But I also got to expose myself to things like dental research, which is rare unless you actually try proactively to get into something like that. It's not something that is very commonplace. So you get this chance in this program to do that. So I got to crystallize a protein for salivary amylase, and that was an interesting experience. I remember by the end of my time there, we actually crystallized the protein, but it wasn't large enough to put through the X-ray diffraction machine for structural analysis. So they said they would expand upon the work that I had done after the fact. Not sure what happened after all that. I'm hoping my name is somewhere in some publication, but that was a cool experience. So I really upped my game in my master's program, graduated with honors, and it's not to say that I suddenly was perfect. It's just that you learn as you go. I feel like the study techniques that I learned in undergrad were foundational, and then I kind of tweaked things up and learned what works for me. And that really helped me in my master's program. So it made me very confident. I was a lot more confident in my learning. So once I was done with that, I said, let's apply again. So I finished my master's 6 months earlier. I loaded up on credits in those first year and a half, those first 3 semesters. And then I utilized the remaining time to just focus on the DAT. And I just retook it and then I applied. And I guess now looking back on it, it was kind of a bold move, but I only applied to 3 schools. It was UMDNJ because that's where I was doing my master's, and then NYU because, being in the Northeast, you always hear about NYU, and then Boston University. And funny enough, Boston University was a school that one of my friends from UMDNJ had gotten into the semester prior to me. So she had a little bit of a background and was able to kind of inform me about things. So touching upon that, when you're researching the school you want to go to, you got to utilize various resources here. The first, of course, being, like I said, if you have a colleague, or now with the social media, this day and age, it's very easy to kind of just reach out to people, right? Be like, hey, I see you go to this school, what's your experience like? Don't be shy about it. A lot of times people are open to, helping each other out. So just reach out, see if someone can kind of help and guide you in that direction. There's also guidebooks. I know the ADEA had like, every so often they come out with like a book with like the school statistics and the average DAT score and all that stuff. So you can find that information, and then you can kind of compile for yourself like a list and kind of just like put in your top, like where do you think you stand, or where do you think that you'll feel the most comfortable, right? There's other things to consider there. And then I don't know if this is still a thing for you guys, but we had something called Student Doctor. It's a forum. And that is basically like a question and answer Reddit type thing where you just pop a question or someone will start a thread and then people respond. So, interviewing tips, all that stuff, it's all there. So that really helped me in terms of figuring out where I wanted to be and how to do it. So, the last bullet point about applying to schools that you can truly find yourself at might be a little bit difficult for you guys because I imagine they're just doing like virtual tours for you guys. But just try and see if you can gain as much information as you can through various resources. So I interviewed at all three, and again, I had a better GPA and DAT score, and I got waitlisted at all three schools by like the end of the spring of 2012. And then August of 2012, I still remember this day like it was yesterday. I was just hanging out in my room, and then I get a call, and very casually, they're like, "Hey, we got an open spot. You want to come?" And I'm like, "Yeah, obviously." So they told me I only had a week to pack up my stuff and get there. So you can imagine it was a very crazy week, but ultimately so worth it. So I accepted the offer. And I had at that time talked with my colleague that I just mentioned to you guys, who had told me that the class size is small. It's a more intimate setting. You're able to get more guidance from your faculty. So I was just very excited to hear that. And aside from that, my experience interviewing was great. So a lot of your experience in being there and talking to people will kind of give you a little bit of a hint in terms of whether you think you can find yourself there. So just something else for you guys to think about when you're applying. Okay, so I'm in. Yeah, now what? So we start off year one with the same old thing, lots of science courses, foundational stuff. And at this point, you're just like, oh my God, why am I doing this again? But it's one of those things where it's just a rite of passage. You just have to do it. The more interesting aspects of it was definitely anatomy, because you're obviously, in the lab and you've got your cadaver and you're doing all the studies, and it's a unique experience that everybody kind of remembers. So, you go through all of that and you're learning time management, because at this point things are going at a much quicker pace than they did in your undergrad or even your master's if you did one. And you got to really learn to time manage really well. And this is something that's going to carry yourself through even now with work. Like, time management is everything. So it's something that you learn early on in dental school, is how to manage your time. But let's be real, I have had my moments where I was last minute, literally reading up until going into the exam. So that it does happen, but try to stay on top of it. Try to do your best to really, time manage well. The great thing about BU is they had you in the simulation lab early. What is the simulation lab? It's basically a lab where you have a mannequin head and you're sitting right on the mannequin, kind of like you would with a patient, and you are doing your procedures on plastic teeth. So my second weekend, I was learning to prep for silver fillings. So you get used to how to hold a handpiece. You get used to how to have your posture situated, how to hold your light. You learn how to get used to wearing your loops, surgical loops, right? These are little nuances that take time and getting used to. So early on in BU, we had the chance to get used to all this. You also get your chance to attend dental conventions. This for me is the exciting part of dentistry, because you get to go to this almost like a Comic-Con, right? You go and then there's all these different vendors. There's all sorts of courses happening. And then they have the coolest new materials, technology. And then there's socials. When you're in dental school, all the schools get to meet other students. So you're meeting people like I was in Boston. So I was meeting people from Harvard and Tufts. So it's like a great way to kind of connect and kind of see what's out there. And it becomes a motivating factor, aside from, oh, studying you're doing your first year, like, yeah, you know what, this is real. Like, I'm becoming a dentist. So definitely dental conventions are great. So then year 2, we start to expand upon that simulation lab. So we're doing a lot more of those fillings that I told you about. You're learning how to do your white fillings, your composites, and your silver fillings, your amalgams. You're also learning how to make dentures, which is a long process, and it goes a lot slower in the beginning because you're doing every single stage, including whatever the laboratory would do for you if you were in private practice. So you learn that. You learn how to make crowns and bridges, and you even learn a lot about occlusion, which is what we say is how teeth meet. And this is a very important foundational thing that you're going to carry with you in your day-to-day when you're private practice as a dentist. So all these foundational things you're really learning in year 2. You also get to do what we call stab lab. That's when, I'm sure you've seen pictures on social media, people are numbing each other up for the first time. It's a great time to kind of take out some frustration and numb up a friend of yours. Just kidding. But no, it's a very fun and exciting time because you get to really just do the things that you've always dreamt of doing as a dentist. You also learn about gum health and how to measure for that and assess for that. A lot of people, a lot of patients call it the pokey instrument, the one that stabs, that has all the marcations on it. And it allows for us to measure heights of what we call the gingiva, the gum, so that we can assess for gingivitis and periodontitis and all of these things. And again, you're just doing a lot of practice on each other. So as you're wrapping up year 2, you take your first boards, the first part. There's 2 parts. One is at the end of your second year, and then the other one's at the end of your 4th year. So this one kind of covers everything you studied in the first 2 years. And it's one of those written exams, again, kind of like the DAT. You go to your testing center and then you just take the exam. And then you get to celebrate a little with what we call a white coat ceremony. It's fun and exciting because this is kind of like your rite of passage into the clinic, seeing real patients, live patients now. So you can see that's us there at our white coat ceremony. All right, so year 3. We're starting to finally wind down on all those courses. Studying finally starts to wrap up there a little bit. And you're in the clinic, starting to see live patients. It's an exciting time. And you start to do what we call treatment planning. Now, what is treatment planning? Basically, treatment planning is the comprehensive plan that you've created for a patient. You have to assess the hard tissues, meaning the teeth. You have to assess for decay, if there's any restorative needs, as in, does the patient need a crown? Does the patient need a filling? You need to be able to communicate these things to them. You also have to assess for soft tissue. So you look at the gums, as we had just talked about. You also assess the cheek and, importantly, the tongue. You have to screen for oral cancer. And there's a lot of presentations, a lot of pathology that can present in the mouth, in the soft tissues. And this is something that you learn in dental school in your didactic courses, but then you can screen for it on your own patients once you're in the clinic. And then in your off time, when you're not seeing your own patients, you can actually assist your colleagues and, see how they do certain things and kind of learn from each other. You can also see specialized clinicians. If your school has a program in oral surgery, you can watch how they extract teeth. You can watch how someone does a root canal if you have an endodontic program. So there are various things you can do to get exposure aside from just seeing your patients. And then there's lab work. I know I mentioned this before, but you're going to be doing a lot of the steps yourself that the laboratory will do for you when you're in private practice. But the reason for that is because you are going to be the clinician who needs to understand everything in terms of every step of the process in order to troubleshoot if something happens, in order to perfect something if need be. And the only way to truly know that is to know how each and every step goes. And that's kind of what this process allows you to do. And then there's 4th year. 4th year is a busy, busy, busy time, and it goes quick, you guys. Externship is essentially a program that BU had set up for us to basically go to an off-site, usually like a community center, and basically be the functioning dentist there. It's quite amazing. You're literally on your own. You have your own dental assistant and you're starting to do fillings. Some places allow you to do root canals or even extract teeth. And you have a mentor, someone to guide you and kind of watch you and watch your work. They'll check your preps. They'll check to see if you're doing everything the right way and kind of make sure they steer you in the right direction. And for us, I believe it was a 2 to 3 month rotation that we did, but it's something that definitely helps to boost your confidence a lot and feel more comfortable with just live patients. And then you have graduation requirements that you need to make sure you fulfill. For every school, it's kind of different. I know for us, in terms of the amount of crowns we needed to do, it was over 10 crowns. In terms of dentures, I remember I did like 5 dentures. So there's various requirements that they need to make sure that you're fulfilling in order to meet graduation. And then the part 2 I mentioned to you guys, it's another written exam. Just go to your testing center and take that. That, of course, is another arduous process in terms of studying, but this is more tailored to what you're doing in the clinic in year 3 and year 4. So in a way, I felt like it was easier because you're doing it almost every day, right? So it's not one of those things we have to read a textbook and kind of memorize something. I mean, there are definitions and things like that you have to know, but for the most part, these are things that you're doing on a day-to-day. So it didn't feel as difficult as part 1 did. And then the licensure exam. This, I think almost every dentist will tell you, is probably one of the most memorable experiences of their life because it's the most stressful and crazy. Everyone has their own story that day. And I will tell you, my story also is no different. My brother actually ended up being my patient because I couldn't find anybody. And the poor guy was nice enough to just be like, do what you got to do. You basically got to do a front filling, a filling on a back tooth, and then you got to do a deep cleaning on one quadrant, meaning one side of the mouth, either a quarter of it. So I did both the clinical and the written part. And I should have mentioned, but there's also a mannequin part where you basically cut for a crown and then they kind of evaluate your preparation to see how it is. And you guys, the mannequin portion, I failed. And it came to a shock to my entire study group because half of us passed, half of us didn't. And we weren't sure what happened because we all studied together and we're like, how could this happen? You know, we all did the same thing. And, you know, there's no rhyme or reason to it, but it's one of those things where you go home, you get upset about it, you get up the next day, you get right back on your feet. Like I said, all good things take time. And it's one of those things where you just have to persevere through it. And thankfully, took the exam the next month. It was fine, passed it, no problems. So once you wrap up with all of this stuff, you start to think, okay, well, what am I going to do after graduation? And you've got a couple of options. You can specialize if there's something that you feel you're more inclined to in the time you were in the clinic at school. You can do a residency, and we'll get to that in a second in terms of what you can consider if you want to do residency, or you can go straight to work. And that's the beauty of dentistry. There's many, many ways to go about it. There are many different avenues. So this is the time for you to kind of figure that out. And then there's graduation. And you guys, that day will come so fast, let me tell you. And in a way, it's so sudden that you feel like you didn't get time to take it in. But it's definitely a memorable experience for sure. All right, so I want to touch upon community service real quick because it's something that's pretty near and dear to my heart. There's nothing like giving back to your community. There's nothing that will feel any better than that because it's really your chance to reach out to those people who don't get the care they deserve. The underserved population almost everywhere is filled with disparity. You know, there are people who have infections in their mouth that don't know they have it, or worse, oral cancer. So this is really an opportunity to help that population out. So one thing that you do early on that I got to do in dental school is provide oral health education, starting with school-age children, teaching them how to brush, teaching them what floss is, you know, being able to instill those habits early in their life so that they can educate their families and hopefully carry that message on, right? And then, like I said, just serving the underserved and providing that oral health education is so key. You know, like I said, there are many times where patients are just unaware of what the implications of leaving decay in your mouth could be. It could lead to worse issues. You know, studies now are showing there is a link between cardiac problems and oral health, diabetes and oral health. So these are things that we need to make sure we inform the community about so that they can get their health in control. I also had the chance to do a lot of dental packaging, dental kit packaging, where you basically put together toothbrush, toothpaste, floss, and kind of give the underserved a chance to have the means of basically taking care of their oral health. So, you know, you don't have to be a dentist to do any of this. You know, you can, I'm sure if you Google in your area right now, I'm sure with the pandemic, it's hard, but there are things still going on to try and help your community. So I encourage all of you to do that. Now, residency, even with everything that I just told you guys, there's still so much learning to be had. And this true learning takes experience and time. And I will tell you, even now, I'm still a student. Even now, there's so much for me to learn. There's so much for me to grow upon. And that's always going to be the case in dentistry. The learning never stops. So residency is great because it gives you a kickstart. You know, it gives you the confidence to kind of get out there and do things on your own with feeling more confident doing it. So a lot of states actually, like New York and California, now require that you have a residency before you even get a license to practice. And it's for this reason. You know, the experience that you get and the ability to be better as a clinician is unparalleled having that experience. So I highly recommend it, you know, to anyone who's considering. I say go for it. I did mine at Jacobi Medical in the Bronx, New York. And again, I did it because I just wanted to be more confident. It was interesting because my experience was a great hybrid of your day-to-day dentistry. I was doing your fillings, your crowns, your root canals, all the stuff that we had just talked about, but on a more frequent basis with, you know, guidance and mentors to kind of be like, okay, you can do this better this way, you can do this better that way. But then I also got a surgical experience out of it. You basically get a pager your first day, and your sleep will never be the same again for that year. Because you have a pager that will basically be your way of attending emergencies in the emergency room in the hospital. And those can vary from chipped teeth, someone falls, chipped a tooth, to big swelling, someone's swollen and you need to drain the swelling for them. Or even they get hurt and they lacerate, they cut their lip, their cheek, their tongue, things like that. So you really get confident with doing these things. And you have a surgeon working with you if you need be, and you kind of just, you know, you get in there and you do what you got to do. So it was an awesome experience. You also get to rotate through a lot of the specialized parts of dentistry. You know, I just said there are many ways to kind of go about things when it comes to after graduating. So if you're considering specializing, this is the place to kind of get more exposure to see if you want to. You have the pediatric dental aspect where you're basically going to be working on kids and you get the chance to see if that's something you really like, you know? Can you handle a crying kid? Can you not? You know, these are things to think about. Then there's surgery. I personally love surgery. We'll get to that in a second. But this is your chance to really engage in those things if this is something you're interested in. And there's also things like anesthesiology and special needs. Like I said, you're going to be working hard. I clocked up to 80-hour weeks sometimes, but it's totally, totally worth it. All right, to specialize or not, like I said, residency is going to be a great help in figuring that out. I personally decided I want to be a general dentist because I like to meet patients of all different ages with all sorts of needs. It just keeps things exciting and different. You really don't know what to expect the next day. And, you know, this may not be the case for everybody. Everyone's goals are kind of different. Everyone's likings are kind of different, and that's okay. You know, I recommend if you still feel at the stage where whether or not you did a residency, you're not sure, maybe see if you can reach out to a specialist in your area. Just look them up, reach out to them and kind of see. Like I said, I think social media helps a lot now because you can just DM somebody and say, hey, I'm interested in specializing. What do you think? And kind of get their guidance with that stuff. So personally, for me, the goal is to own my own practice and just be the general dentist for my community. So what kind of job do I want? Like everything else we talked about, another learning process. We have a common theme here, right? I practiced in various types of settings in Central and North Jersey before deciding where it is that I felt was best for what I wanted. You have your Medicaid offices. These are very fast-paced. You're almost always serving the underserved, which is not entirely the case, but for the most part. And a lot of times it's problem focused, right? Because they don't have the means, they don't have the access. So you're doing what you can for them to kind of keep them out of pain and keep things in control. Then there's your standard private practice. It's your normal dental office, and you do your comprehensive treatment, and you've got your standard insurances that you accept, and things just, you do your bread and butter is what we call it. And then you have your corporate offices. This is something that I think is becoming increasingly popular in the US. We see them almost everywhere. There's Aspen Dental, there's Dr. Dental, there's so many. And these are also fast-paced. These work a little bit different from an associate aspect because you have someone managing basically the managerial aspects of things in terms of how financially things run. And that can kind of, I guess, help ease the stress in the practice by having that. And then there's fee for service. This is where patients come and they pay out of pocket and they don't have insurance. And you really got to make sure that with these patients, everything is experience focused. So you just got to go the extra mile and make sure that each step of the way, they're really comfortable. So what to consider when getting a job? The most important thing for me is growth. Your potential to grow, not only financially, but professionally is really important. Like I said, it's a lifelong process learning, but you never want to feel complacent with where you are. You need to make sure that where you are is constantly not overwhelming, but challenging yourself enough to grow, to learn, and to just be a good dentist. And then, of course, realistically, we've got loans to pay. Dental school ain't cheap these days, you guys. So we got to make sure that it can pay the bills, make sure that it makes sense for you financially. Another thing that I think I've learned over the years is distance. If you have a job that's an hour away, sometimes you can clock in 10-hour days at work, 11 hours maybe, and then you have an hour commute back. It's a good chunk of your day, right? Working and driving. So that can probably lead to burnout over the years if you're doing it often. So that's something to consider for sure. There's also mentorship and guidance that I think is rare and far between, but if you have it, keep it. It's amazing to have that guidance even in private practice. It's one of those things where, you'll be confident enough to kind of, do things on your own. And for the most part, practice owners are busy, especially these days. They want you to kind of carry your weight yourself, but you also want the chance to learn and tweak things as you go. And to be able to do that would be really helpful if you were able to find it. And then another just thing to consider is just the nature of the procedures you're going to be performing, because you do want to play on your strengths, but again, you want to grow. You want to have a chance to grow in those weaknesses. And some places might not allow for it. So just consider that when you're picking a job. Like I said, with time and experience, you'll figure it out. I started off in the Medicaid office, and now I work for a private and a fee for service. So as things go, you'll learn what you need and what you want to do. All right, now the fun stuff. Let's talk about cases. So another big benefit of residency is you're going to be able to do the things that you find very exciting, that we all find very exciting, those big cases where you're changing someone's smile or you're doing, reconstructive work. Doing this in private practice is not something you get every day, especially early on in your career. So that exposure, that chance, I had in residency. So if you see on the left here, on the top left, this wonderful woman came to me with what we call congenitally missing lateral incisors. Essentially, her lateral incisors were missing from the time she was born. And early on, she had orthodontic treatment in order to space everything out properly, align her teeth, and then create enough space that we can basically put teeth there for her through implants. So she had the implants placed prior to my starting residency. So when she came to me, I basically had the job of just restoring the teeth. And what I mean by that is first you have the implant surgery. The implant is placed in the bone surgically, and then there's usually a healing time, 4 to 6 months. In that time, we have what we call osseointegration. What that means is that the bone is attaching to the fixture of the implant. The body is accepting it. And once the healing time is done, we test and make sure the fixture is fixated as we need it to be. And then we get our impressions for a crown. So that's where I stepped in, and that's what I did. I made her 2 incisors, and the case, well, it took some time because when it's front teeth, there's so many little nuances to consider. Black triangles being one, in terms of making sure the gums are sitting right at the right place and not basically introducing any gaps to the front teeth. And then there's, of course, the color, because you want to make sure everything looks as natural as possible. Her lip line sat right in the ideal position where basically it was right under her gum line. But and I wish I had a zoomed in version of this, but we had it in a way where there were no black triangles or anything like that. So the day of delivery, I still remember I inserted it. I was very nervous because, again, you're a resident, you're still training, and you don't know how patients can react. I give her the mirror, and she starts crying, and I'm just waiting, like, are these tears of joy? Is she happy? Is she not? And she was overwhelmed with happiness. She was so happy. She said, I never felt better in my life. So these are the things that are your aha moments. Me and my boss, we always talk about it, like, find your aha moment on a weekly, monthly, whatever it is basis, because it's going to keep your passion alive for what you do. Yeah. So now we're going to talk about surgery because it's my favorite thing to do. I love to pull teeth. If any of you follow my Instagram, every so often you'll see I'll post teeth because to me, teeth are like fingerprints. Everyone's got something unique going on, whether it's the root form, the way the crown of the tooth looks. There's so many things. So I got this little video that I hope plays. You can see how I'm taking a forceps and I'm doing a little bit of a sideways action to remove a tooth with an infection. You'll see that little bubble right there. I'll play it again so you guys can see it again. And just a little funny tidbit. Most people think when you're extracting teeth that you got to be big, muscular, strong. You got to be able to really get in there on the patient's, knee on the patient's chest to really yank the tooth. Not the case at all. It's about patience, technique, and just making sure that you know what you're doing. And that comes with time. I'll walk into a room, patient will see me, I'll introduce myself, and they'll be like, okay, when's the doctor coming? And like, I am the doctor. I am the one pulling your tooth. And eventually they get comfortable and they realize it, and then they're super thankful after the fact. But I'll play this again just so you guys can see. It's a little bit of a back and forth and then a little bit of a twisty action, and it came right out. And this was after I had luxated, meaning separated the bone from the tooth enough to create space so that I can get my forceps in there and just loosen it right out. So you guys can see that right there. And then on the bottom right side, you have the same idea. You have a dental infection. That one was probably one of the biggest ones I've seen thus far. You can see how sizable that soft tissue infection is. And these are things, like I said, that can manifest themselves chronically. It can be there for a while. And it's one of those things that is worrisome because it can spread elsewhere, and cause bacteremia. All right, so on the bottom left, we have another tooth. This is a wisdom tooth, number 17, which is on the lower left side. And the reason why I want to present this tooth to bring it to you guys' attention is because if I wasn't patient, so many things could have gone wrong with this tooth. You guys can see that there's this big hole, big old gaping hole right in the middle of the tooth, and there's a thin shell of enamel kind of just hanging out right there. Had I rushed things, that thin shell would have broken right off, and I would be just left with a root tip in the bone, at which point I would probably have to take a drill, remove bone and then kind of just pick at it. And sometimes even when you're picking at it, it'll come out in pieces. And the more it comes out in pieces, the more of a surgery it becomes. The more surgery it becomes, the more delay there is in healing for the patient. And you really want to make sure when you're doing that call to check in on them the next day, the day after, that they sound happy, because that's what's going to have them back in your chair again. So, I just took my time with it. I luxated, the same thing I explained to you, where I separate the bone from the tooth, and then very gently, very slowly do the same technique that I just showed you guys. So patience is key. Oops, sorry, you guys. Okay. So now I just want to leave you guys with just some general tips, advice, just things that I think I've been learning in my journey so far. Like I said, learning never stops. So these are things that I've taken note of. The first is that dentistry can be challenging and sometimes really test your patience. Whether it's someone who's fearful and anxious and kind of just doesn't want to have you in their mouth, or something that's just complicated and it's just taking forever, not going your way, something's breaking over and over again. Things are going to happen, and you have to really learn to just roll with the punches, but stay focused and patient. And these are the experiences that are really going to teach you good character. Balance is key as a dentist. Schedules, especially now with COVID, very hectic, very busy. But you got to make sure that you give yourself and your loved ones proper time, because the more self-care you practice, the better clinician you'll be, and the more you'll be able to give to your patients. They say you can't pour from an empty cup, and it's true, you can't. The road is not going to be smooth, and there's going to be obstacles. You guys heard it from my journey, but be persistent, work hard, and there's always going to be a way to accomplish those goals and dreams of yours. And like I said, dentistry is a lifelong journey. You're going to be learning through it, clinically or even personally. Embrace it and enjoy it all along the way. All right. Thank you guys so much. It was a pleasure to speak. Here are my socials. I can be found at Dr. Rubia on Instagram, and there's my email. Shoot me an email. I am open to questions. And if you guys ever need anything at all, just reach out. Thanks.
Thank you so much, Dr. Ruby. We do have some time for questions, and we got some questions on our YouTube channel and Instagram. So first off, this was an absolutely amazing PowerPoint and presentation, so motivational. And thank you so much from the whole team. Okay, so our first question is, this is regarding board exams, and what are the statistics for board exams? So pass and fail, and what happens if you do fail a board exam, and how many people do that, and just kind of stuff like that.
Sure. So I can't provide statistics now because that's something that obviously changes with the years. I'm now 5 years out, so I'm not sure how accurate it will be. But I can tell you the overall majority will pass. And it's just a matter of when, I can say, because I think in my class, we had a class of 115 students. Almost all, except for maybe 2 or 3, didn't pass, but then they retook it again. And to follow up with that second part of the question, I believe there's a time frame in terms of how much time you have to retake the exam. And the same holds true of the licensure exam. I just mentioned to you guys, the mannequin portion I had failed. So I had, I believe it was a couple of months to take that. So the next month I found the next available date. And then from that point on, I was just practicing to take that test. So the overall majority usually does. And that is basically because the school will do a good job of preparing you for that and making sure you have the foundation you need in order to succeed.
Awesome. Our next question is, for you personally, was dental school harder, or was dental school as hard as you thought it was, or was it harder or easier for you?
I think it was one of those things that you never really are prepared for. So in a way, yes, it was hard, especially that first year. You're still learning. You're still learning how to study. You're still learning how to manage your time. But it's one of those things that I think will become easier once you figure out what works for you. Yeah.
Awesome. Okay, our next question is, throughout dental school, obviously we're doing a lot of studying and preparing for all the exams and stuff. So what are your study tips, or how did you find yourself studying a lot to be successful?
Really great question. And it's one of the things that I did want to touch upon is I first started like we all do, where you take your notes and you highlight and you organize and all of that. And that was great and all. It works a little bit in undergrad, worked
Mhm.
in my master's program. But what I found really helped me in dental school was having a colleague or a study buddy that you can actually speak the content with. I feel when you're able to speak about a topic, you basically know enough about it to talk about it, right? So it kind of gives you that chance to audibly hear yourself as you're discussing the topic, but also reinforcing it to
Mhm.
yourself and to your colleague. So me and my colleague would take turns,
Mhm.
they would do one chapter, I would do another, and then we would kind of just quiz each other on it.
Mhm. Mhm.
Study
Mhm.
groups are so key. I was so fortunate. Our class helped each other on everything.
Oh.
If someone had a helpful resource, they would share it with the rest of the class in an email. So really just, be there for one another because that's really going to help you.
That's awesome. Okay, our next question has to do with dental school and debt. Like, obviously, it's very expensive to attend. So, how was like debt after dental school, and is it hard to pay off or stuff regarding that?
Yeah, dental school is not cheap.
Mhm.
So another big piece of advice, and I guess you could say it's a pearl, is only truly get into it if you really want it because it's not cheap. I went to BU, which was expensive. I came out with basically $500,000 in debt. And the fortunate part for me was that if you are able to get federal loans, you are able to do what we call basically a pay as you earn program, where you're going to pay a percentage of what your income is after you graduate at the time in order to pay off the loan. There's also options if you're going through a hard time financially. For example, right now with COVID, things are in hardship forbearance for almost all of us until things stabilize a little bit. And that is beneficial because right now there's no interest being compounded on it.
Mhm.
So another thing to consider is,
Mhm.
are you going to be able to make those ends meet? For me right now, it's one of those things that I'm managing as it goes,
Mhm.
but it's going to take some time to pay that out, that amount out, especially
Yeah.
with the interest.
Yeah.
So be mindful of that even when you're picking what school you want to go to, because it's going to be something that you have to
Mhm.
deal with after you graduate.
Yeah, absolutely. Let's see. So, kind of switching gears here and going back to like when you were a pre-dent and like applying to schools and then getting an interview. How was your interview experience typically, and like how's the rundown and like what kind of questions do they ask?
Yeah. So dental schools usually don't ask you technical questions because they want to gauge to see how well-rounded you are.
Mhm.
They want people who are approachable, comfortable to speak with, because our field is a very personal field. Like I said, you have to be able to make your patients comfortable. You have to be, approachable enough that they can trust you with what you're doing. So that's what schools look for. For me, I think all three schools, I had pretty good interviews. Everyone was very kind and very approachable. Nothing was awkward or anything like that. But I think BU in particular was great because it's super diverse. Everyone comes from all avenues of life, and it's one of those things where you feel comfortable being able to kind of just be in your own skin and just go through the journey. So I had a good experience, and I think that for the most part, if you're well-rounded, if you've got, various things going for you in terms of outside of school, they're going to ask you like, what do you do on your free time? That's a
Mhm.
big question actually. So if you show them that, you do have a personality, it does go a long way.
Awesome. Thank you.
Yeah.
Let's see. Our next question has to do with extraction. So it can definitely be intimidating just kind of watching the video and it's kind of scary like pulling it out. And so what are your tips with getting comfortable with extractions and stuff?
Yeah. So I was fortunate enough to start with colleagues who had been in the oral surgery program. So, they're young and they're approachable. And I was like, oh my God, I'm scared. I don't know how to do this. And, my colleague was fortunate. I was fortunate in that the colleague was there to kind of watch me and kind of
Mhm.
just like talk me through it in a way. The
Mhm.
first time I did it, I still remember. You really got to just take that leap of faith in everything that you've learned to that point. And you got to start somewhere. And that's not to say jump to wisdom teeth, jump to what you saw me doing. There's patients who have severe gum disease that have teeth that are mobile, teeth that move, that really don't require that much instrumentation to remove it. So while you're in your training, I'm sure if you express that you want to try to a colleague, to a teacher, to whoever, they'll be like, okay, they'll find the right fit for you or the right start for you.
Mm-hmm.
I remember my first tooth was in a hospital and it was a single rooted tooth. It was like a premolar. So they're much smaller. They're easier to remove. So that's a good way to kind of just build your confidence until, of course, for me, it was later in residency that I was able to get comfortable with using a handpiece. And it's one of those things, the more you do it, the more comfortable you get. There are things that you don't even think about now. And you're like, wait a minute, how do I explain this? Because it's one of those things that becomes so innate. So you got to start somewhere, but take that leap of faith, reach out to someone, buddy up with someone, and you can do it.
Awesome. Thank you. Okay. Our next question has to just do with the real world versus dental school. So how is like dentistry different, like when you were in your practice or in your real job versus kind of in dental school?
Yeah, things are a lot faster pace. And by that, what I mean is when you're doing a filling, you get 3 hours in dental school, which sounds crazy when I say it now. But of course, in the beginning, you're scared and, it's a real life patient with a real life tooth. And there are so many things to consider. So, and you obviously also have someone kind of guiding you and checking each step of it, checking the prep after you've removed the decay, checking the filling after you've, finished it, making sure the bite is okay. These are things that go much, much slower when you're in dental school. Coming out of dental school, even in my fee-for-service practice, if I'm doing one filling, you do it in 30 minutes, at the most, 45 maybe, depending on how difficult it is. So it's one of those things where you have to adapt. But again, that residency that I told you guys about, it's so key because that speed and that confidence, you're going to get that experience in residency. Your day is kind of going to be mimicking what your real working life is going to be like. So for me, that transition didn't feel as big because I had that opportunity in residency.
Awesome. Amazing. Let's see. Our next question kind of has to do with, finding a job after dental school or residency and how easy it is and what are kind of things that you should look for when applying and all of that.
Yeah. So it's relatively easy to find a job because, again, people are always going to have tooth pain, cracked teeth, the works. And there's always going to be a need to address this in your community. So dentists, for the most part, are always looking for help, especially right now with COVID. So it's not so difficult to find a job as it is to find the right one for you. And as I said in my PowerPoint slide, and you guys are totally welcome to send this out to whoever would like it. There's so many things to consider. For me personally, the personal and financial growth were big factors, but also just the ability to get mentorship and do the procedures that I want to grow upon. So yeah.
Awesome. I think we have like time for 2 more questions.
Sure.
So the first one just kind of has to do with private practice. You had mentioned that that's kind of one of your goals. So if for someone that wants to, or for you in the future, what are kind of the things you need to do and expense wise and just strategically speaking?
Yeah. So there's a lot that goes into running your own practice. And one of the things that I have to say that dental school doesn't prepare you for, neither does residency, it's how to manage your practice financially, logistics, administrative aspects. These are things that you only learn with experience. And these are things that I'm just starting to gain exposure to as I become an associate for the various kinds of practices. So there are courses out there to learn this stuff. Linking up with someone who's done office management work for a dental practice is great because they can kind of give you the lowdown on insurances and how that work. There are various formulas and various ways to tailor your practice, and for everyone, it'll be different. Excuse me. So it's very important to just really take your time learning that. And I think that's kind of the stage I'm at right now. And then also prepare yourself for the financial commitment because that's not cheap. and depending on where you live, what part of the US you are, most likely you're not going to be open 5 days a week when you first open
Mm-hmm.
your practice, or even 6. You're going to start off with 1 or 2 days. You're going to be an associate for the remaining days, and you're going to be saving in order to have the funds to keep the
Mm-hmm.
practice open and pay your employees and all of that. So
Mm-hmm.
it's one of those things that's going to take time and lots of money.
Yeah. Awesome. Thank you. So I think our last question is going to be just kind of your like final thing about like, what do you think is the most challenging part about dentistry for you, and then the most rewarding for you personally?
Okay. So I think the most challenging thing sometimes is when patients come in with preconceived notions, whether it be in terms of who you are as a healthcare provider or in terms of what their expectations are for you. Now with the internet, some people will Google a root canal and they'll come and they'll be like, yeah, we read about this. We watched a YouTube video. So they'll try and dictate how you do your work. So being able to navigate that takes a great deal of patience. Ultimately, for me, it's been a rewarding experience because I'm a very chill, kind of like low key person
Mm-hmm.
at work. So I kind of let them kind of, say what they have to say. And then I'll be
Mm-hmm.
like, yeah, you're right. That's cool. But this is how we're going to do things.
Mm-hmm.
So in that way, you kind of make them comfortable and you kind of, do what you got to do. And on that same note, that's the most rewarding part is
Mm-hmm.
just having someone come in either fearful or anxious or feeling like, they've got these preconceived notions, and having them alter that mindset that they came in with,
Mm-hmm.
especially being a female, a South Asian female. There are so many stigmas attached to that. And
Mm-hmm.
you would be surprised how many times you get it. A lot of times, even with all my gear on in COVID, patients will come and say, "Hey, you look too young to be a dentist." And I'm like, "Really? Is there an age for this?" But it's one of those things where once you make them comfortable and they see that you're working hard and you're doing the best you can and give them the best care, it's incredibly fulfilling.
Awesome. Okay. So I think that's all for today, everyone. And I just want to say thank you so much to Dr. Ruby again for an amazing presentation and then a Q&A session. And yeah, that's all I have to say. And Gabby.
I appreciate it. You